I don't have a great deal to add, except I will assure you our officials are moving very rapidly to action the decision that was made today. And we do expect in very short order, it is reciprocal that those measures will be put in place. But I'd also like to make the point, I would very much urge Canadians and Americans to respect the principle behind the decision that was made and avoid non-essential travel.
We'll go to CBC.
Dr. Tam, you're in constant contact with your provincial counterparts on a daily basis. How many ventilators does Canada have and test kits, and how many do you estimate that we need?
Well, right now, the federal, provincial, territorial table on looking at logistics is very much meeting every single day. Certainly, we are actually preempting any need for ventilators by purchasing some already from the federal level, even though there hasn't been any specific request necessarily for some of them. So we're trying to just preempt any need. In terms of the other supplies, for example, we've secured 800,000 swabs just for test kits, for example. As I've said, Canada's already tested 50,000 people. 800,000 swabs go some ways, but it doesn't mean we can stop. We just have to keep getting more on an ongoing basis. So this is not a sort of a static reality. But the reality is that there is global challenges in securing certain supplies and certain types of personal protective equipment. What I do know is that of the personal protective equipment that is needed by Canada, we can currently expect to meet those needs about at least 75% of the requested amount, but we're pulling all stops to look at any other suppliers, bulk purchasing, and any other means. So, but I don't want to say that in Canada, we shouldn't be taking really good care of our supplies. We mustn't waste things. We've got to be really careful in the hospitals and how you actually use those supplies. And so we're working really hard also to provide guidance to people on the sort of stewardship aspect.
And I think Patty has something to add.
I'll just add to that. Obviously, we're working through Health Canada, Public Health Agency of Canada, and with the Minister of Procurement and her team to put in large orders, because we know that even though the provinces and territories have indicated what they think they might need, in fact, we may need more. And I think Dr. Tam has been clear and quite direct in saying that we are not the only country looking for these kinds of supplies. So we are also working with the Minister of Innovation, Science, Economic Development, I think that's still his title, Minister Baines, to make sure that we have a capacity within Canada to in some cases help factories and other manufacturers who maybe are not able to make the things that they sell right now, but can rapidly retool to make the things that we're going to need. So that work is happening right now. And the reason we can't give you exact numbers is because it is in the fluctuation period. As provinces are drawing down materials from our national stockpile, of course, we're trying to seek to replace those and, in fact, increase the amount that we need over and above what we may eventually use. I think this is the prudent measure to ensure that we can have what we need, ensure that we even perhaps buy more than what we need. But I will also say that manufacturers globally are trying to make sure that countries aren't stockpiling in a way that will actually prevent the ability of other countries to get what they need. So this is a global effort that is happening on procurement and on trying to coordinate what countries will need when they are seeing the sort of epidemic or the spike, if you will, of their particular curve hit. It's really important to remember that actually those global communities, those countries that don't have access to those kinds of supplies matter just as much, even though it might not seem so when you're in the middle of a crisis. Because in fact, if we can't actually think ahead to what countries that are going to be hit next will need, then if their infections increase, then that continues that wave of virus from circling the globe. And what we're trying to do is accelerate our supplies from an immediate urgent need, accelerate our work on the treatment for COVID-19, and accelerate our work on a vaccine. because until we actually get all of those three things working together, we could actually see a scenario where we would have the virus continue to circle the globe. And that's the true challenge here. So we're working very closely, as Dr. Tam has said, with our provincial territorial partners, but also our international partners to make sure that what we procure today, we have a capacity to, first of all, use, and then possibly share down the line if we end up having more than what we need. And all of that evolves in real time. That's why it's so hard to give you precision around numbers.
And I just want to underscore one thing that Patty has said, which is very important work being led by Minister Baines and Minister Anand, and which was discussed today by the premiers in their call with me, and is actually really inspiring, which is Canadian manufacturers are putting up their hands and are stepping up and are looking at whether they have the capacity to retool and to produce here at home the things that we need. And that has really been just an example for me of Canada coming together, Canada being united. They are being extremely creative. They are working with the provinces. They are working with us. We'll have more to tell you as these ideas and these efforts actually come to bear fruit. But it is a real example of a Team Canada approach. And I am very grateful to all the manufacturers who've been in touch with us, who have been in touch with their provincial leaders to say, you know what, I think I can make this stuff for our country.
Restrictions. President Trump said, quote, "It's not pertaining at this moment to trade between the two countries." Could border measures affect trade, and what could be the consequences?
So it's a great question. And a reason why we took the time that we needed to work this through carefully and cooperatively with our American neighbors was because we understand how essential that trading relationship is, and our American neighbors understand how essential that relationship is as well. So you heard from the President, you heard from the Prime Minister. We are absolutely clear that these border restrictions will in no way impede the trading relationship. They will in no way impede the essential trade happening between Canada and the United States every day. We understand on both sides of the border, the last thing the Canadian or U.S. economies need right now is another blow. So this is really about saying discretionary travel shouldn't happen. If your trip is not essential, if it's for tourism or recreation, just don't take it. And there is tremendous clarity on both sides that trade needs to continue, and essential workers need to continue to cross the border to do their jobs. And I want to really underscore one other thing, which is, this is a time when all countries in the world, as we heard from Dr. Tam, this is a global pandemic. Every country is really struggling with tremendous challenges at home. And in that struggle, I think that it is a very positive thing that Canada and the United States have managed to handle our border in this very collaborative and reciprocal way. And it says something about the partnership that we have here in North America. I don't know if Bill would like to add anything there. Do you have anything to add?
I will also simply chair. I'm having very regular conversations with my provincial counterparts. All of them have stressed the importance of maintaining those supply chains and economic activity that crosses back and forth between our borders. And they cite very specific examples. That observation really informed our discussion with our counterparts in the United States, who also recognized its importance. It's important today. It's important every day. The food that goes on our shelves, the pharmaceuticals that we will require, are all part of that international trade between our two countries. But it's also essential to maintain those supplies to facilitate the economic recovery that will come. Many of our businesses and are suffering or going to suffer in the very difficult circumstances that we face in the near future. But it's also important to maintain the economic conditions that will give rise to our recovery. And that was also very much a part of our discussion with our American colleagues and with our provincial partners across the country.
Le devoir.
Monsieur Duclos, ma question est pour vous. Beaucoup des annonces qui sont faites aujourd'hui concernent l'assurance emploi en fait
We've been talking
des
about
programmes parallèles dans un contexte où vous avez beaucoup de fonctionnaires qui travaillent de la maison, qui sont peut-être pris par leurs enfants qui ne sont pas à l'école.
public officials
Il
are
n'y a
working
peut-être
from
pas
home,
de réseau
their children are
sécurisé.
not at school.
Quelle confiance avez-vous de
What,
pouvoir traiter un si grand
how
nombre de
confident
demandes dans
are
le
you
contexte?
of being able to
Merci. Et effectivement, le
process so many
message aujourd'hui, c'est qu'on
applications?
n'oublie personne
Thank you.
avec les mesures historiques qu'on met en place pour
We
aider
are putting
tous les travailleurs,
unprecedented measures
les
in
familles
place to
et les
ensure that all
entreprises.
workers and families,
C'est
as well as
un ensemble de
businesses,
mesures qui est historique. Il n'y a personne qui n'est laissé pour compte dans les mesures que M. Morneau a
no one is
annoncées,
being left behind
que ce soit des
with the
gens
measures that Minister Morneau has
admissibles ou
announced,
non à
whether
l'assurance-emploi, que ce
people
soit
are
des gens
eligible for
qui
EI
ont
or
besoin d'être à la
not,
maison pour prendre soin
whether it's
d'eux-mêmes,
people who need to be
pour
at
prendre
home to
soin
take
de
care
leurs
of
proches,
themselves,
que ce
to
soit
take
des
care of their
enfants
families,
qui
their
n'ont pas
children,
d'école, que ce soit des parents qui ont
who aren't
besoin
going to
d'aide,
school, whether
ou que ce
it be
soit
to
pour
take
des
care of
raisons de
elderly
perte
parents,
d'emploi. Tous
or
ces gens,
because they
tous
have
ces
lost their
travailleurs, toutes ces
jobs.
familles
All
sont
these
appuyés,
people,
et en
all
particulier
workers
les
and
plus
families are being
vulnérables.
supported, especially
J'ajouterais
those
aussi, avant de
vulnerable
passer à
among
votre
us.
question,
And
que quand on parle
also
de
before going
vulnérables,
to your
on parle
question,
aussi
when
de
we're talking
très
about
vulnérables.
vulnerable, we're also
Et que
talking
certaines des
about
mesures qu'on a
very
annoncées
vulnerable
aujourd'hui,
people.
et vous allez
And
le
some of the
constater en
measures
regardant
announced
les
today,
informations,
when you look at them,
apportent un appui considérable à certaines familles qui en arrachent présentement et qui vont en arracher encore plus dans les prochaines semaines. Laissez-moi donner l'exemple d'une maman monoparentale avec 2 enfants à la maison qui se retrouve à la maison parce qu'elle a besoin de prendre soin de ses enfants qui sont pas à l'école ou parce qu'elle a perdu son travail. Mais cette personne, déjà, recevrait à peu près 1 000 $ par mois en allocation canadienne pour enfants et va recevoir, avec les mesures annoncées ce matin, un autre 1 500 $ et en plus, elle va être protégée. Parce que si elle perd du revenu, parce qu'elle ne peut pas être au travail, qu'elle a perdu son travail, qu'elle soit admissible ou non à l'assurance-emploi, elle va recevoir autour de 450 $ par semaine au cours des 15 prochaines semaines. Donc, c'est une mesure qui est là pour dire à tout le monde, on ne vous oublie pas. Maintenant, évidemment, pour que tout ce travail se fasse correctement, ça prend la contribution substantielle de la fonction publique et on a confiance dans la capacité de la fonction publique de faire ce travail dans des circonstances absolument extraordinaires parce qu'on sait que les fonctionnaires de la fonction publique non seulement vivent aussi ces difficultés, mais sont conscients de leur rôle majeur dans ce qui s'en vient. Donc, les services informatiques s'ajustent évidemment à la demande. Les consignes sont claires. La priorité, c'est de prendre soin de soi-même et de ses proches, de profiter au maximum des opportunités de télétravail, sauf dans des circonstances exceptionnelles où la sécurité ou l'intégrité du fonctionnement du gouvernement serait mise en cause.
On pense vraiment pouvoir verser l'argent en 2 ou 3 semaines. On sait que déjà, quand on place une demande pour l'assurance congé de maladie, ça peut parfois prendre des mois, il y a des longs retards, et là, on a moins d'employés pour le faire. Quel geste posez-vous pour vraiment vous assurer que ça va aller vite?
2 choses. En gros, il y en a plusieurs autres. La première, c'est le fait que des modifications, des améliorations qui devaient être faites prochainement au système d'assurance-emploi, par exemple, ne seront pas faites aussi rapidement que prévu. On va concentrer nos efforts sur ceux et celles qui ont